Welcome to my world. Another day, another time, another period for knowledge acquisition. Knowledge is power, health is wealth. Today's topic has to do with blood loss updates. When we talk about blood loss, it's very easy for anybody to comprehend that yes, it could be accident when you or injury when you start losing blood. But there are certain blood loss that is not the menstruation blood loss or stuff like that, but you just find them declaring the person anemic. What blood was lost? You want to wonder how come this person is anemic, and that is one aspect that we shall be looking at, and what can be done that may not necessarily be the whole blood that is transfused. And these are updates that I shall allow you in acquire more knowledge on, which would help in broadening our understanding of blood loss. This update is particular about the components of blood, how we have been able to really in a way produce this component more or less artificially. I wouldn't say naturally, because these are something that have been synthetically produced. So if you like my video channel, as usual, press the like button, subscribe, and more videos will come your way. But be patient as we move on into the slide session so that you can have more understanding about the updates. The outline: the objective, introduction, type of blood loss, lab diagnosis, replacement of blood updates. The conclusion and recommendations are what I shall be dwelling on in this video show. The objective: to create a deeper understanding of blood loss that is not obvious to the naked eyes but is life-threatening, and also exposes the role of the medical laboratory scientist blood transfusion practice with the updates. Introduction: blood loss can be taken as a situation where there is injury to the circulatory system and blood escapes from the damaged vessels, which could be external as in accidents, surgery, childbirth, menstruation, etc., or internal as in bruising. With bruises we could state internal hemorrhage, cancers, etc., and where the loss is chronic, it is termed anemic. Anemic conditions could also be hereditary, hemoglobinopathies, aplastic anemia, etc., or lack of essential vitamins like vitamin B12, folate, and minerals, iron, necessary for blood formation ab initio. When blood loss starts and no treatment measures taken, the blood volume goes down, which may result in hypovolemic shock as the heart finds it difficult to pump blood and maintain oxygen delivery to all the cells of the body. The heart will stop pumping, other organs will shut down, and the patient goes into a coma. Death is likely, and the blood transfusion becomes a necessity. That is where the medical laboratory scientist's role becomes eminent and imminent. Approximately 29,000 units of red blood cells are needed every day in the US, especially with the military involvement. Nearly 16 million blood components are transfused each year in the US. So let's promote blood donation. The blood loss type. Like I earlier mentioned, external blood loss is visible. Accidents resulting in considerable blood loss. Major surgical operation resulting in considerable blood loss. Women in childbirth and newborn babies in certain cases. Severe burn victims. The internal could be listed as iron deficiency anemia. Even when menstruation, during menstruation, women who menstruate usually suffer that iron deficiency, so they need to replace it, although the body is always up to the task. Patients of hereditary disorder like hemophilia and thalassemia. Cancer patients, those who have especially the gastro problem, ulcers, and colon cancers, the colorectal cancers requiring therapy, aplastic anemia, hemolytic anemia, anemia of chronic diseases like cancers as well, HIV, AIDS, kidney diseases, Crohn's disease, etc., etc. Laboratory diagnosis. There are 8 major groups of blood, namely Group A positive, Group A negative, Group B, Groups AB, Group O positive and negative. It is only Group O negative blood that can be safely transfused to anybody. Group O positive blood is the commonest and considered universal donor if they are not considered dangerous Group O donors. Hemoglobin estimations and PCV, even the red blood count, where you want to know the MCH and MCV, are done to determine the need for transfusion. Grouping and cross-matching are done for safe blood transfusion. The laboratory diagnosis is very important, especially where it concerns the components, transfusion, and as well whether it can be remedied with just giving folic acid or vitamin B12 or iron infusion. Injection. The reason being that once you look at the film reading or the MCV and it's showing macrocytic anemia, you suspect that it could be vitamin B12 of the folates. But when it is microcytic, you want to suspect iron deficiency. And there are certain values you get from the MCV that is very indicative of these deficiencies. And the component too, you can always know it from the PCV as well as also the sickle shape, the sickling shape of the red blood cells to know what action to take. Yeah, blood replacement update. When you look at this diagram, it shows clearly the blood in its 3 parts. You can divide it to 3 parts. They are not equal. The bottom part is the area where you have the red cells mainly. The middle part is where you have the puffy coat containing the white blood cells and platelets, whereas the uppermost is the plasma, which contains the water, the glucose, which is necessary for glycolysis, salt to maintain the integrity of the cells, protein for all the proteinous maintenance, buffer maintenance as well. And then you now look at the normal range when it is like that. So from this, you could see whether it is red blood cells that is very low, that you just pack the cells and give, or whether it's this plasma that is lacking and you want to infuse, or whether it is platelets and the WBC or whatever the patient present with. So updates are many, but I shall limit it to blood and blood component as seen in the diagram. So let us use this diagram to really inform us of what and what we want to touch, the components we want to touch, the lymph, the platelets, the white blood cells, the red blood cells, or even we just want to replace the plasma. Yes, our journey so far has shown that blood transfusion practiced by medical scientists is therapeutic. So red cells transfusion are life-saving for patients with major bleeding. The clinical condition of the patient should dictate transfusion rather than a number, that is just looking at the whether you want to stick to the pragmatic 30% and stuff like that. A patient who rapidly goes from a PCV of 45% to 20% will be sicker than a patient who is chronically at a PCV of 17. That is clearly explaining that the dramatic lowering of that PCV is very instructive for one to save life. Because if that continues, the whole blood will be hard, and then all the organs will shut down, and the person would just go into coma first or death. Treatment option other than red cells transfusion for anemia include erythropoietin produced by the kidney and oral or intravenous iron therapy. The glycerolized red blood cells have a frozen storage life. This is one of the fine ways of storing the red blood cells so that it can stay for 10 years. Usually The highest number of time you could store blood is 35 days. But if you deglycerylize the red blood cells by adding glycerols and frozen storage, that could last up to 10 years. But requires special equipment to thaw and deglycerize. The available data shows no difference in early efficacy with complications when compared to standard product red blood cells. Complications and inadequate blood supply to meet demand have revolutionized the provision of artificial blood components, and red blood cells are under development. Two major types of red cell substitute are under development: hemoglobin-based and perfluorocarbon-based. The perfluorocarbons are completely synthetic, like I earlier mentioned in the introduction. The hemoglobin-based substitute use hemoglobin from several different sources: human, animal like cow, and recombinant. The recombinant hemoglobin is obtained by inserting the gene for human hemoglobin into bacteria and then isolating the hemoglobin from the culture. This process allows for the manipulation of the gene itself to create variant forms of hemoglobin. 1 unit of hemoglobin solution can be produced from 750 liters of E. coli culture. Yes, platelet is a component of blood. Lyophilized human platelets. A lyophilized platelet product has been under development since the late 1950s. The current process involves briefly fixing human platelets in paraformaldehyde prior to freeze drying in an albumin solution. The fixation step kills microbial organisms, and the freeze drying greatly increases the shelf life. The adhesive property of the platelet appear to be maintained. This product is currently in animal trials, so very close to being used for human. Conclusion: blood loss from all my exposition so far shows clearly that if there is a known cause, then prevention is a possibility by avoiding the risk factor. External or visible blood loss could be avoided by keeping traffic rules. That is, if you are driving a car or a motorist, avoiding unnecessary risks that could damage blood vessels. The internal are associated more with a balanced diet that help maintain good health. Also, if it is hemoglobinopathy or any hereditary hemolytic anemia, then uphold counseling advice, where partners are even advised not to marry AS. Cancers could also be hereditary too, so do regular checks for early detection to avoid this condition, especially with colorectal cancer, as I explained earlier. If it's in the family, that yearly examination could help start early treatment, which will not allow the cancer to metastasize. I have decided to add recommendation because of the last experience, and as such, I say, because there is an established high demand for blood and its components, there is a need for continuous provision of blood, which can only happen through advocacy for voluntary blood donation. So, if you feel that you are very healthy, based on, you go to the lab, you will be tested, and it will be easy for you to donate. Because if you find that you are not healthy enough that the blood is not enough for you, nobody would ask you to donate blood. Blood donors need blood supplements after donation, especially iron, to replace depleted ones. Oxybrita is also a product that is given to sickle cell patients that suffer from sickle cell anemia, to stabilize the shape of their blood to prevent sickle shape, and so should be made more affordable so that we can have less demand for this blood donation. There are so many recommendations that I can make, but time is of essence. But if you like my presentation, please click the like button, subscribe, watch more videos. There are so many. I think I've made over 156 videos and still counting.